My name is Mahlatsi Baloi, a final year nursing student from the University of Pretoria. Today I'll be performing an assessment of the neonate, but the main focus will be on the head. So I'll just be assessing the head, looking for any abnormalities in the head or any injuries that the baby got when they were being delivered. I am going to do the assessment on baby Tugarabo, who was born on the 24th of April 2022 at 10 to 10 with an APGAR score of 6/10 in the first minute and 9/10 in 5 minutes. So the equipment that I'm going to need for my assessment is my hand sanitizer, my gloves, and my tape. And also the environment is very therapeutic for the baby. As you can see, the baby is going to be assessed in a warmer, and there is adequate light in the room and privacy has been maintained. Please note that I have gained verbal and written consent from the mother to perform the assessment on the baby. So now I'm going to move on to do the assessment. For the general assessment of the baby is not in distress. The baby has a vigorous cry, but the baby is not crying now, but she does have a vigorous cry. Also the skin is pink and well perfused. The nappy has been changed before we got the baby from the mother, and skin to skin was done before the assessment, and also the baby was breastfed before the assessment was done. So moving on to the assessment, I just put on my gloves. When I went to get the baby, I did my social hand wash. So the first thing we're going to do is measure the baby's head circumference. Okay, the head circumference is 34 centimeters, which is within the normal ranges, because the normal head circumference is between 33 centimeters and 37 centimeters. Now I'm going to check the shape of the baby. The baby's head shape is normal, round, and there are no indentations on the baby's head. So now I'm going to move on to assess for any caput and molding. There's none. And then I'm gonna now palpate the fontanelles. So the fontanelles are not supposed to be too sunken or too distended. When they are too sunken, it shows that the baby is dehydrated, and when they are distended, it shows that the baby has intracranial infection. And also molding can be staged, graded. There's grade 1, 2, and 3 molding, so the baby does not have any molding. So then I'm going to assess the sutures. The sutures are not supposed to close prematurely, because that would infringe on the baby's development, brain development and growth development. So the sutures did not close prematurely. So then I'm going to assess for any injuries on the baby's head that could have occurred, maybe by the use of forceps or kiwi during delivery, and there are no injuries on the baby's head that are visible. And then now we're going to move on to assess for any abnormalities in the face, and then we're gonna start with the eyes. So in the eyes, we are checking for any signs of cataracts, or if there's any discharges draining from the baby's eyes. And then we're going to check the nose. Just check if the nasal bridge is fully formed, and also if the nose is open. And then we're also going to check the ears. So with the ears, I'm just gonna check if they're on the same level with the eyes, and also I'm just gonna do that to see if the ear goes back to normal like immediately. And then we're gonna move on to the mouth. Just gonna put my finger in the baby's mouth to see if the baby has a good suckling reflex, and the baby does have a good suckling reflex. And then I'm gonna also check for palate, if there's any soft palate or cleft palate, and there's none. And then also we're gonna look at the tongue of the baby. The color is pink. Okay, and then also the baby's lips are well formed. They're pink. And then now we're gonna move on to the neck to check for hyperthyroidism. And there is none. The baby's neck is normal. So there were no abnormalities observed on the baby when we were doing the assessment. So the baby was covered and taken back to the mother for kangaroo care and skin to skin and breastfeeding or nappy change if needed. And if there were any abnormalities, I was going to record them in the maternity records and report them to the sister in charge for the day. Thank you.